Fight diabetes, stay away from it if you can, and never run low on vitamin B12 if you want to retain or maybe even regain penile sensitivity. My name is Stefan Buntrock. I'm a board-certified urologist and sexologist, and in this video, I will be giving you crucial information about penile numbness and how to deal with it. Nerves are so important when it comes to sexual function. If they don't work properly, you can run into all kinds of problems: erectile issues, orgasmic difficulties, pain, and loss of sensitivity. It is not a law of nature that you will retain neural function until the very end. Peripheral nerve malfunction often occurs with age. Usually, the whole peripheral nervous system is affected, including the penis. This condition is called polyneuropathy. There are numerous reasons, and I could spend 20 minutes listing them. In short, we are talking about certain chronic diseases, diseases of the nervous system, infections, cancer and therapy for cancer, drugs, malnutrition, and poisons. Not surprisingly, about 5 to 8 adults out of 100 suffer from polyneuropathy. There may be an acute onset or a gradual increase over time. Polyneuropathy is one of the main causes for penile numbness because it destroys nerve function. Now, I don't want to go too much into detail here, so I am giving you the by far most common reasons for polyneuropathy: diabetes, alcohol, and quite often there is also a deficiency in vitamin B12 and sometimes in vitamin B6. The risk in diabetes is mind-blowing. Up to 50% of the diabetics will develop some kind of nerve damage. Alcohol is a neurotoxin. It is a poison, very bad for nerve function. Chronic abuse of alcohol carries a risk of up to 66% for developing polyneuropathy. People who drink a lot of alcohol often develop a deficiency in the vitamins B6 and B12, resulting in major adverse consequences for the body, including polyneuropathy. But there are also other non-alcoholic reasons to run into vitamin B12 deficiency. These include chronic infections of the stomach or intestine, drugs for excessive stomach acid or diabetes, if you've had intestinal surgery with removal of certain parts of the small intestine, or a shortage of the so-called intrinsic factor. As with any neural damage, regeneration is very slow, and in many cases, it is impossible to completely revert the damage that already has occurred. Take spinal cord injury, for example. If the injury is incomplete, there may be some progress with neural rehabilitation. However, if the injury is complete, it results in a lifetime of wheelchair use. So here's what you should do. Avoid obesity at any cost, since it is one of the main reasons for developing diabetes. If you have diabetes already, reduce your body weight, work out on a regular basis, take your medication, and stick to your prescribed diet. Do everything you can to control it. Because, and here's the good news, type 2 diabetes may be reversible. If you have polyneuropathy already, it is important to find the cause of it. If it is possible to identify what's wrong, get treated. Talk to your doctor about your personal risk for polyneuropathy regarding your current medication. It doesn't hurt to supplement with a vitamin B compound preparation that includes B12 and B6. It is also possible to measure B12 in your blood. Overdosing is possible, but it doesn't occur very often. Then there is alcohol. If you already suffer from polyneuropathy, you should stay away from alcohol if you can. If you put the advice of this video into practice, you can do something for yourself to counteract penile numbness. Thanks for watching. Bye-bye.